All right. So about Dr. Esra, Alhamdulillah, she passed, and I'm so happy. And now I will be kept myself muted for like I think a long period of time because she has to share a lots of things with you, and she will guide you through, and she will give you a lots of tricks what you can follow for your future exams, and it will come in handy for your exam, trust me. Okay, she's a brilliant student, and also she's one of the top scorer for from the September session, like from KL, okay, from the England College. All right, Dr. Esha, it's all yours. Share your experience, share your journey. How did you start? When did you pass part A? And what was your journey? Please share with everyone. Everyone will be very happy to hear from you. Go ahead.
All right. Yes. First of all, thank you so much, Dr. Atik Bhai, for such an gracious and generous introduction. I am not, I do not subscribe to that. I'm probably not even 10% of what you said about me. But yes, I would like to say I'm very glad to be among my colleagues around the world, and I can I can understand that most of you, because there was also a time but I also joined these success stories just to listen to what the ones before me who had passed through the same journey had to say, and listen to their experiences and probably learn from that. So I can understand that a lot of you are very excited, nervous, going through different stages of your preparation. So I'll try my best to share my experiences, and if you could learn, or if it benefits any one of you even a little bit, then I'll be very glad. Okay, so I passed my MRCS Part A in September 22 of last year, and then I joined the IMG group. I think it was probably in November or December. So I had no idea, I had no clue at how to start my preparation for the MRCS OSCE. And at that time, what I did is there were a lot of notes that were available online, various notes. So what I did is we had a small study group. We went through those notes. We learned together. That's how we started roughly in general. Then finally, but then I think just like everyone, right? There's a lot of doubts and a lot of misconceptions and a lot of I would say myths surrounding the MRCS OSCE exam. There's a lot of mistruths around how the exam is taken and what is recalls, what are the which center is better, if there's any bias among the centers, these things. So these so initially, I remember that during my preparation, I started, with all my vigor. I remember I covered all the knowledge part just within a couple of months. But then skill part, I think majority of us, right? Probably there is a huge portion of us who are already surgical trainees, but then there's also a significant portion who are not surgical trainees. So that was always something that I felt nervous about or inferior about. That okay, I'm not a surgical trainee. Will I be able to do the skills part properly? So Alhamdulillah, towards the end of my preparation, I attended Atik Bhai's hands-on course and hands-on workshop. So that really helped me be quite confident during the skills part of my exam. And particularly, I had no trouble. I just breezed through the communication part as well as the history part. And I believe both of them really helped me, not only pass, but also, score well in the skills part. As for my in general preparation, I followed Atik Bhai, like I also contributed to as well as followed one single set of notes. So there's always the tendency to look for different notes, learn more notes, and but it is my sincere advice that although you always feel a tendency, okay, that person has this note, that person has that note, may collect all of them, let me learn them. So it is just a pure waste of time. Stick to one set of notes, stick to a good set of notes, and practice that very well, because the knowledge part of the exam it's kind of like a marathon, right? If you're unable to complete that set of questions in the allotted time, it is going to be very difficult to pass. So, and I want to say confidently that majority of the questions has come from the notes. Definitely, there will be around 10 to 20% of the questions that are out of the notes, because this exam is a standardized exam, right? There's always going to be a subset of questions for those who have learned more or understood more or have a better conception. But that is just for getting good marks or great marks. That is not required for passing. So when you sit to learn for this exam, you should always have that mindset that I need to pass this exam, because it is a very expensive exam. Financially speaking, it takes a lot of logistical setup. You need to take time off work. You need to manage a lot of assets. You need to book a hotel. You travel to a different country, right? So your target is that I need to pass this exam, right? And if you get good marks, that's alhamdulillah. But if just chasing, like chasing unicorns, just going for notes here and there, that is not going to be a wise decision. And the other thing, so once you're done well with your preparation, what you should do, you should attend mocks regularly. So the mocks, it's up to you what you feel comfortable with. Initially, I started my mock sessions, it was just a group of friends together. We asked one another in a timed manner, and then we started taking part in Dr. Atik Bhai's mocks, because they were very structured. And most importantly, you have to take your mock with someone, at least your study partner. You have to select in such a way that they give you a very honest and very correct feedback. So they should be attentive while you're answering or performing a particular examination, or your communication or history taking. They should be able to identify where you went wrong, what you could have done better, right? Because if you the main thing about mocks is that the notes is common for everyone. Like 90% of you all have the same study materials, right? But the difference, where is the difference between candidates? Difference is some people are able to absorb them in different manners, and some of them are able to produce better and others not so much. So so that's the thing. You have to frequently give mocks, right? Frequently practice, so that you can identify where your weaknesses are lie, and you can work on them. um okay so what else to say? I think, like, okay, I'm at
Esra,
loss of words.
yeah, tell me something about the exams. Like, how was it? Like, what was your strategy just before your exam? Like, for 15 days. Okay. Also, like, for within the exam, what did you do? What was those stations? How did you overcome? How was those things? You can share those things as well.
Yep. All right. So I want to say one thing is, like, probably my strategy was a bit different in the sense that I had to tailor it as per my needs. So just I booked my exam in the February of this year. So I remember the opening seats were open around 6 months ahead. So once I booked my exam, I had to, for different reasons, I had to join for a new job 4 months just before my exam. So 2 months before my exam, I understood that, okay, I need to join some job. I will not be able to give that much time to my studies. So that's why I've actually finished learning the knowledge topics, as well as a majority of the communication as well as history prior, like 4 months in advance. And because I think most of you are in the same dilemma, right? We are either you're surgical trainees, or you're doing some job as well as side by side preparing for this exam. That's why what you should do is, at least the theoretical part of your exam, you should learn them very well, so that what I did is, during my work, whenever I used to get 10 to 15 minutes break, or while I'm traveling to work, right, I used to put my headphones on and I used to listen to all the classes and all that. And then I used to always have my notes with me. I used to always carry a very heavy bag to and from work, carrying my bulky books, but they were very close. They were always close to my head, and I always felt kind of nervous, to go to work without my books. And I used to look at the books and look at my notes and revise them frequently, uh, during work and also after work. Okay, so I did not get much. I did not get much, holiday or leave for the purpose of the exam. I think I got just maybe a couple of either 5 to 7 days before I flew to Kuala Lumpur for my exam. And in that time, what I did is Atik Bhai had given a roughly, kind of like a schedule of how you should, what you should cover in that time. So I remember that in the daytime, I used to learn the knowledge part, and in the nighttime, I divided my, my time through the week. Some days I kept for history, some days I kept for clinical, like that. And then another thing is that my study partner, she also lived far away from me, so the knowledge and the knowledge part predominantly we learned online, but we could only practice just a few days before the exam when we were together in Kuala Lumpur. And just before the exam, what I did is it's very tough to focus on anything, and there was always a tendency. Okay, these are the new questions in that particular diet or that particular center. They asked these new questions, so everyone goes for question hunting at that time. But what I did is I just sat in my room, put my headphones on, and I just listened to all the classes in a loop. I think I covered the entire knowledge part in probably 2 days. And then the skills part, I just practiced with my friend. It's a bit, this is probably not the most ideal way to study, but I had to tailor it as per my needs. And my advice to all my colleagues would be that don't go for any set plan. You should know yourself well. You should know your weaknesses and your capabilities very well, so that you can tailor a perfect study plan that is customized for you. Okay, and about the exam, I think Kuala Lumpur is a very, very famous center, particularly among Bangladeshis, given its proximity, as well as it's the financial as well as the logistic thing. It's easier to give an exam in Kuala Lumpur from our country.
Also, it's a very
I did not.
standard center, very
Yes, yes,
standard.
yes, definitely. In my experience, RCS England, like there's a lot of what to say. There's a lot of myths and misconceptions regarding RCS England, that a lot of people say that Edinburgh, they make the candidates pass. The exams are quite easier. The exams are quite predictable. Yes, that's all true. But there's the false misconception that RCS England, they always give harder questions. They introduce new stations, things like that. I did not at all feel that during my exam. During my exam, I felt like there was a very standard set of examiners, both local as well as the British examiners. I did not have any difficulty communicating with any of them, but they were extremely standard examiners, in the sense that they will not give you the feedback then and there. You will get your feedback only the day where you get your result. So that's something that made me nervous, because during practicing during the mocks, it's like always we get an instant feedback whether we did good or whether we did bad. But during the exam, like I thought, okay, oh, just looking at my, like, they had such a poker face. It was so difficult to understand whether I was doing good or bad. Like I was confused whether they're accepting my answers or not. But Alhamdulillah, as for the result, they have accepted the answers. And so there's a lot of misconception that the examiners are very rude, the examiners are very strict, the examiners are not fair, they're biased. So I think, see, and these things also plagued me as well as my colleagues and my study partners while we are preparing for exam. My sincere advice is that the things that are out of your control, right? Like this and that, completely forget about them, right? What's in your control is your preparation as well as your confidence, how you approach the exam. So you have to work on that only, and the rest is in Allah's hands. I want to say one thing about the skills part. In the skills part, you must be extremely confident. I think all of you are aware of the breakdown of the mark distribution. In skills part, you have some amount of mark allotted for communication, some for professionalism, some for patient safety, and just a fixed amount for the examination or the skills proper. So a lot of us, right? A lot of us, or at least myself, what I felt, that I was very scared. Okay, what if I miss this during my examination? Like, let me tell you, I made lots of gross mistakes. I had a peripheral vascular disease. I forgot to do Burgess test. I remember in CBS examination, I told the examiner that this is confidently, like absolutely confidently, I told him this is a case of aortic stenosis, very well knowing that the only things that come in the exam are MR and then pacemaker and all that, and prosthetic valve. But then I said it's aortic stenosis. Then what else? But the thing is, still I passed. Right? Still I passed. So I want to say this: even if you make some mistakes in the examination part, if you kept the rest of them proper, say you're very professional, you're communicating well with the patient, and most importantly, you're maintaining, the hand washing, the fact about screening the patient, asking for permission, asking for a chaperone, right? Basically, all of these are covered where? These are covered in your 10 steps approach, right? So if you maintain this, still you have a very good chance of passing. Still you have a very good chance of passing. So always keep in mind of, where your marks lie and try to, target those. If you feel like your weak point is an examination, I strongly suggest get a very good and, meticulous study partner whom you practice with a lot, and they are also honest with you and give you, the accurate feedback regarding your, weaknesses and all that. And also attend a good hands-on where you can clear up your doubts, learn the most standardized and best examination pattern, so that in your exam you can be absolutely confident. And regarding knowledge, is just rote learning. Once you understand the concepts behind it, the pathology, critical care, anatomy is nothing to understand. It's all about visualization. Once you understand that well, all your job is just one thing: revise, 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 and produce, produce, produce. How will you produce? By attending mocks, by giving your, by producing the answer to someone, and your answers should be the tip of your tongue. So because even the manner in which your answer takes into consideration, like, I think, I don't know whether a lot of you know this, that in knowledge part there are two scoring patterns for each station. One scoring is like, just question wise. So you have question number 1 to 10, each is either marked 1 to 2. So you answer the first question, you get 1 mark. You answer the second question, you get 1 mark. Answer the third question, you get 2 marks. So this is one scoring pattern. And the other one is the global scoring. In global scoring, the examiner is just asked one question: what do you think? What is your general idea about the candidate? Uh, Poorly performed, performed averagely, performed well. It's like that. If you see the MRCS, Royal College candidate guidance, that is like a PDF, you will see that this is written there. That's why the thing is not only whether you answered or not, the way you answer, the confidence in answering, whether you're sitting up and whether the answer is the tip of the tongue, or they're prompting you repeatedly to get the answer out of you. It matters. So say for example, they asked you a management of something, right? And if they keep on asking you what else, what else, what else, what else, that means the more they prompt you, that means you're not confident, or you're not going to be able to do that independently. Someone else has to remind you that you're missing something critical. So you can understand your marks will go down, or the global score will go down. Okay? These are some things that uh, I think, if you can.
All right. So, a very sweet story. After the exam, she called me or I called her about her exam, what was those things and everything. And the first thing she said is, "Hey, I'm going to fail this exam." Okay. And before the exam in the course group, I have like said to all the candidates, the topper is going to give her exam tomorrow, and she will be the topper. Okay. So I had that confidence for her, and alhamdulillah, she had like I think almost like on her day maybe she's the topper, and it happened. Okay, so the most important part was don't lose your confidence no matter what, wherever you have gone wrong, right? So that's the key to pass this exam. Okay, so about the skill part, Dr. Esra, like, can you just share something about the history taking, or you mentioned about the clinical examination, yes, but for all the other candidates, can you just share about what you did for your communication and also about the history taking, or also about the procedural skills a little bit more?
Yes, yes, definitely. Okay, so let me start with the communication. That means communication with the patient, right? As well as communication with your colleague. That means the phone call. Both of them, like, the scenario is just the ones that are mentioned in the notes, right? But the only thing that you can change or do better is in the notes. It's not mentioned how you should be sitting, what is your tone of voice, your eye contact, right? How you place your hands on your lap, how you keep your feet together. You're not allowed to cross your feet. You're not allowed to, lean back on your chair or talk carelessly, right? You're supposed to maintain eye contact with your patient, right? And I think, I don't know if anyone has given OET before, but that will really help you in your communication skills. In that, they have a basic expectation from a doctor of how they should communicate, right? First of all, uh, you should be very you should be communicating. That 9 minutes is for you to keep the conversation going. You have to remember one thing, that you're the patient, right? Or is not responsible for keeping the communication going. And I think all of you has probably heard from different colleagues who have given the exams in the past. Sometimes the patient actors, right, they just sit quiet. They sit quiet unless you ask them something, or you keep the communication going forward. So remember that the burden of communicating is on you, right? You should prove that you're a good communicator. So first of all, for me, the station that came was arthroscopy got cancelled, right, for a patient, right? So you can understand the patient is naturally expecting to go to an operation. So you should enter in that way. And always introduce the basic general steps that are mentioned in all the notes. Introduce yourself. Good morning. I'm Dr. Esra. I'm one of the surgical doctors. May you please confirm your name and age. It's nice to meet you, John. Today I've been asked to have a conversation with you regarding your operation. Is it okay if I take a seat and talk with you right now? Right. So these simple things just in this introduction, right? You're starting off very strong. You've introduced yourself. You've confirmed this is patient safety, right? The whom you're talking to. I think, I don't know, it has happened to me personally. If you don't confirm the patient's identity, you might be giving the wrong information to different patients. So first of all, that makes the patients very confused. And number two, that may also violate confidentiality. And these things are very kind of important big legal issues. That's why they take this thing very seriously. That if you forget, like, I've practiced with so many candidates as well as colleagues and study partners over the time, right, over the past year. And without fail, definitely there are some people who miss this same simple thing of introducing themselves before starting a conversation, or getting to know the patient and his name and his age, right? So you should make this just kind of your reflex, that you're never going to miss these two simple things. Then you have to understand, okay, so then first of all, before you start on into a rant, you should first ask the patient what is his understanding of his situation right now. So John, so I believe you're expecting to have your operation right now. Is that it? And he'll say, yes, yes. And then he'll start getting up. Right. When you have to say, and then you have to break a bad news. Basically, what is this? This is breaking bad news, right? Breaking bad news has the spikes protocol. Slowly, you have to first lower your tone of voice. Okay. You have to understand what is their understanding. Yes, he thinks he's going to have an operation right now. And then initially you have to, break it slowly. You have to give some warning shots. Okay, John, I'm have some bad news for you. It's not easy for me to say this right to you, and probably this is not what you want to hear from me right now. These are some things, then he'll be prepared. Okay, there's something worse is coming. You have to tell him, unfortunately, your operation has been deferred. This is because blah blah. What's in the notes? You're just gonna say that, right? But what's the difference? The difference is you have to maintain your eye contact. You have to lower your tone. Like I remember during my exam, I was speaking so softly. I felt like, my own voice was breaking. Like I was going into some, playing a role. And I felt like crying, out of empathy for the patient because his operation is being deferred. And I think my examiners picked up on that because they were smiling and like, nodding their head and all that. Okay. And yeah. All right. So like this. And then the patient will say so many things, and there are different prompts, right? The patient, there are some legal prompts in the sense that the patient will say that, I want to sue the consultant, or he will say that, I want to, file a complaint. or he'll say that, I want discharged right now. I want to change the consultant. So all these things are what? These are your ethical questions or your, legal questions, and you have to answer just the way it's in the notes. But whatever it is, whenever a patient tells you something like, oh, I'm having so much pain, what is your first job? It's not to subscribe painkillers. The first job is to empathize. I'm so sorry you're feeling this way. I can only imagine the distress you're in right now. What I can do for you is may first see what painkillers you're on. And the patient will say, okay, I'm so sorry about that. I will try to talk to Mr. Man to get you and to change your prescription so that it suits you better. Something like that. So just the rule of thumb. If you're giving any bad news to the patient, you have to be very sorry. If the patient says something of difficulty or distress, you have to be very sorry. That whole station, arthroscopy station, is a sorry station, right? Like Karthik Bhai said, it's a sorry station. You have to be sorry in each and every step of the way. No matter what you say, first you should say with sorry, then you should empathize, and then you should give him a better alternative. Like say, for example, he's saying that can you give me an exact date for my operation? You have to first say sorry to him, because you can't give him, right? You cannot fulfill his expectations. You have to say, I'm so sorry. Then you have to explain why you can't do that. This is because at any point, a medical or surgical emergency may arise, and any life or limb threatening operations will always take the priority. And Mr. John, you must understand that, because had your life been in any danger, you would really want us to go ahead and save your life first. I hope you understand. Then, but you can give him a good alternative. What's the alternative? What I can do for you is I can talk to Mr. Man, and I can talk to the OT scheduling team and highlight the fact, your case, that you have been deferred twice, so that they keep you as a priority while setting the new OT list. Does that sound good to you? So when you're offering something good to the patient, right, you can take feedback. Does that sound good to you? Something like that. So I enjoyed that station a lot. Prepared for it well. It was a very good. It's a good station because there's a lot of different prompts, right? And you have the capability of showing your range of how you manage the different things. And other than these ethical and legal prompts, you also have some medical questions. Like I think this is a new question in all the stations. It's like sorry, no, in the arthroscopy station in all the centers, is that the patient would ask you, okay, I've been scheduled for this operation, but I don't even know what it is. Can you explain to me what an arthroscopy is? So you're supposed to, this is a medical question, right? You're supposed to explain to the patient something. And then you just explain in your own words, but just make sure that it's layman terms and that you're not using any medical terms. And then after you explain something, what is your job? Your job is to, gather understanding, right? So these are this is basic points of communication. When you explain something, you have to follow it up with gathering understanding. So you have to ask the patient, do you understand what I said to you? Would you like me to repeat anything for you, right? Or do you have any questions or queries for me? Some things like this. So you have a lot of range. Communication and history, right? These are 4 amazing stations. They're very easy and straightforward. And this is your station. If you feel weak in skills, in weak in examination or procedure, these are the 4 stations that you can prepare extremely well for, so that you can easily pass your skills
What was your
overall.
trick for the history taking then? As you were saying, these are just some easy like stations, right? But most of the candidates, whoever said like during my course, and everyone like said, history taking, I am fear of history taking. I cannot complete that, right? So what was your tricks for the history taking, Esra?
Okay. Yeah, I mean, I did not use anything special. Just like we have the 10 steps approach and this
Yeah.
thing, right? See, the thing is, like if your Guruji says something, follow it. Don't try to make something new, right? Like, see, we have to follow the way of Prophet Muhammad. You're not supposed to, figure out something better. It's up to you. Like, but the thing is, the thing that has worked for several people throughout generations, more often than not, it should work for you as well. If you just stick to the questions, like thing is, in the notes, right, how the questions are set up in a very classic manner. What is that classic manner? First of all, the basic things, you introduce yourself, you greet, introduce yourself, right? Then first of all, identify the patient. right? And then you tell him that, you know, I've been assigned to ask you a few questions regarding health. Is that okay with you? You're gathering consent, verbal consent. So you can understand for each of this is one point. I think what bogs down a lot of candidates, or as what frustrates a lot of them, is they are just, you know, thinking of, okay, how can I complete all the questions in the set? You're not supposed to complete the whole thing, but you're just supposed to gather the appropriate information from the patient. And at the same time, don't forget about the mark distribution, about being professional. Like, how can you be professional when you're entering and you're greeting with a smile? That's your professionalism, right? And when you're gathering a consent, a verbal consent before you go ahead, that is your professionalism. Patient safety is what? You are introducing yourself and your role, and you're gathering the patient's identification. That is your patient safety points. So imagine a lot of people, what they do is they just somehow just go through the initial these points, and then they jump directly to the, you know, questions about, you know, the presenting complaint, or questions about the differentials. See, those are important, yes, but you cannot skip on your communication, your patient safety, and all that, and expect that you will get good marks. Your job here is not to finish all the questions. Your job here is to get the points, hit the main four, this one, the, what is it called, subdivisions, that is your communication, patient safety, professionalism. And here the actual skill proper that you're testing is your ability to take a proper history, right? So if it is any if it is a, for example, if it's pain, right, abdominal pain, Socrates, you just go for Socrates. If you first of all, you start by asking an open question. So how may I help you today? What has brought you here today, right? Then the patient will say, oh, I've been having tummy pain for the past 3 days. So when the patient says he's having tummy pain for the past 3 days, right? When you start Socrates, you don't have to ask about onset, right? So if you say, okay, so how long have you tummy pain? If you ask that after the patient will get irritated. The patient says, oh, I've told you, I got it for the past 3 days, right? So what
Yeah,
does that
just
indicate? That you're
one
not
second.
respected.
One second, Isra. I want to like say something here. Yes. So when I was taking the mocks for last 1 year is the problem in the history taking for maximum numbers of the candidates, they were repeating the same question while giving the mocks, right? So you have to be aware of those things, right? So you cannot like
Yeah.
ask those questions again and again to the patient. So you have to be careful for those things. Okay. Yeah, continue, please, Esra.
Yes, you're absolutely. And this is something that for the examiners, right? The examiners, the your patient actors, they know, they are very seasoned actors, and your examiners are also very seasoned examiners. They have taken exam for innumerable amount of candidates in the past. They know where people make mistake, and this is where people make mistake. You know, everyone's like, "Okay, this is so robotic." In the sense that they just, okay, I have to cover this question, this question, this question. But at the same time, you're taking history, right? You're supposed to listen carefully to what the patient is saying. The patient, I'm having pain in my right side of my back for the past 3 months. You cannot ask him again, okay, where are you having a pain? Rather, what you can do is you can just twist it up. You can say, oh, so you have been saying you have been pain in the right side of your back. That means what? You are confirming with the patient, right? You are verbalizing that yes, you have heard him, and you have heard that he has pain. His pain is in the right side of his back. So something like that, right? And also another thing that a lot of people don't practice. A lot of people practice for all of them, for your examination as well as for history. Everyone practices the examination proper, everyone practices the history taking, but no one practices the presentation. You have to remember, right? It is a 9-minute exam. The first 6 minutes is for history taking or examination, and the last 3 minutes is for your presentation. In that 3 minutes, you're presenting to your examiner, as well as there is a an open setting for asking questions. So what I've noticed is that a lot of people practice only the history taking part, but the thing is able practice presenting the history well to the examiner is also a very important thing, because they will definitely catch you on some points. Say for example, you're trying to establish that this is a case of IBD, right? IBD, not colorectal cancer. But you have to understand, in both of them, there is weight loss. I think I had this issue in my exam, that the patient had weight loss. The patient said about weight loss, but I probably didn't say it when I was presenting. And the examiner caught me on it. Like, the patient does not have weight loss. Like, yes, sir, the patient has around 10 significant weight loss. That is 10 kgs in the last 6 months or 8 months, something like that. So the thing is, you should also practice presenting either the examination or the history to someone. Okay. And then the question is just, the basic set of questions that are in the different notes. What else? What else? Yes. During practicing the examination, a majority, everyone, like, I remember that no one starts with the, 10 steps. Everyone just goes through the examination proper. That means inspection, percussion, palpation, and auscultation, or like the look, feel, move of, or, the orthopedic examinations. But without fail, you have to, whenever you practice, even if it's the 100th time you're practicing something, you should always start with your classic setting as well as your ending well. That means, how do you start? First of all, you will make a habit of washing your hands as soon as you enter the station, not before you're examining, or else you 100% there is a tendency that you will forget. So enter the station, wash your hands, greet, say good morning. My candidate number is 2899, and then okay. Then you will first greet the examiner. He will say, go ahead with the examination, and then you will start with the patient. Good morning. It's the same thing. You will introduce yourself. You will get the patient's identity. You will explain to him what you're doing. You will gather his consent. You will appropriately expose the patient. You will ask for a chaperone, right? And you will tell him, don't worry, I'm going to maintain your dignity throughout the process. You have nothing to worry about. And very, very important, I'm from my own experience with studying with different people, right? Don't forget to ask about pain in two settings. Number one, before you start the examination, and number two, before you palpate the patient, right? So this is a simple thing, but very important, and definitely these. So greeting has a mark, introduction has a mark, getting the patient details has a mark, asking for chaperone is a mark. But when you're speaking to the patient, explaining to him well, all of these has a mark. Even if you mess up in the examination itself, right? But everything else, before the examination proper and after the examination, or just a combination of all that will definitely, I can, like in my exam, I can definitely say this, that it will help you pass. Even if you make gross mistakes during exam, you still have the capacity of passing. Right. Dr. Aditya, these are some things that, the
Yes.
tested and
So
true theories
you
work
you
all the
have
time.
shared a lots of things. Thank you so much for that. Okay, so now I want to ask, like, if you have any queries, like the candidates to Dr. Esra, you can ask, no problem. She'll be, I think, happy to give you the answers. Yes, Dr.
Yeah,
Rajan?
is hand washing is mandatory for history taking also?
No, hand washing is not mandatory for history taking. It's mandatory for your examination. So the 10 steps of your history taking is different. The 10 steps of your examination is different. It's not, you're not expected to wash your hands in history taking.
Okay. For clinical examination, we
Dr.
have
Dr. Rajan, the thing is, whenever you are going to touch a patient, you have to wash your hand. Okay. So in case of the clinical examination and also in case of your procedural skills, that are the two stations where you must wash your hand because you are going to touch the patient, right? But whereas in case of the history taking and also in case of the communication, you are not going to touch the patient. So you don't have to wash your hand. Make sense?
Also, I want to mention one thing, that in our KL examination center, they mentioned to us that in your procedural stations, you're going to be wearing gloves. They themselves admitted that the gloves are not that, sterile or that good. So please do not, or they are a bit low quality gloves. Preferably do not wash your hands before you don the gloves. You just have to say, I have washed my hands. Just announce that before entering when you enter the station, and then don your gloves, because once you use the hand sanitizer, the gloves will become very sticky and they'll start ripping. They will start ripping, right? And you'll have difficulty in manipulating. Like I had a knot tying station. So although they said us beforehand that you do not need to wash your hands, just announce or take it for granted that you have washed your hands and then don on your gloves. What it is, like, I completely forgot that they said that. I went in, I sanitized my hands, and then I had difficulty wearing the gloves, and I had difficulty in the knot tying station because my hands are very sticky, and the gloves did not fit my hands properly. That's why I had some difficulty in tying the knots, but alhamdulillah, I was able to tie the knots. So this is a caveat. This is something different for our station. I don't think it's applicable for everyone, but you can keep this in mind, that if you're in your procedure station, if they tell you this, keep it this in your mind. Yes, any other doubts? I welcome everyone because this it's a good golden opportunity for you guys to clear up your doubts one-on-one.
Okay, Dr. Ishabu, congratulations again to you.
Yes, please. Thank you.
Okay, I would like to know that in case of history taking and clinical examination, if I'm failed to make a diagnosis, so then how it will hamper my exam?
All right. So, see, let me tell you from my own experience. Like I told, right, in the CVS examination, the case was mitral regurgitation. But I confidently, with 100% confidence, I said, what? Aortic stenosis. I still passed. Right? Then,
Yeah.
Yeah, so it will not affect so much. See, like I told you, right? Look at the mark distribution. You have marks for patient safety. You have marks for communicating with the patient. You have marks for your professionalism. Even if you maintain all of that, right? Your skills proper. That
Yeah.
means your history taking skill or your examination skill, right? That has some mark, but that is not all the marks. So you can definitely you can still pass. You can still pass. Then they will also ask you some questions after that, right? It's not like if you get the diagnosis wrong, completely you're going to fail the station or you're going to get zero in the station. Not at all. You will get some amount of mark that you can cover with other you can say the other stations. So
Yeah.
so that you can overall pass in skill. I am telling this confidently. I am washing out my dirty laundry in front of everyone so that I can inspire all of you. Let's see. I also made gross mistake. That happens to everyone, right? But still, there is a chance of passing the exam. I remember I was very, very upset because the examiner told me this is a case of mitral regurgitation. You're saying aortic stenosis. I was like, oh, I was so shocked, right? But the thing is, you have plenty of time. Don't be very afraid. Okay, don't rush through the exam because you will get. The exam is a very standard exam. They have set all this time very, by thinking. But they have set it this time in such a way that you can definitely confidently and appropriately cover that amount of task in that time. Okay, so don't think that you have to rush and finish, start rushing. If you rush and finish and you sit there, right, that's not a positive point for you, right? That's not at all
Yeah.
positive. That means you're not doing it properly. You're just rushing through. You're missing some steps. You're making some mistakes, right? You will get plenty of time. Most importantly, when you finish a station, right, you will get 1 minute to change the station and just to recuperate, and then you have the actual 1 minute of that reading the after entering the next station. So what you're supposed to do in that time, completely just wash out your slate of your mind, forget what happened before, so that you can confidently, with a very confident smile, enter the next station. Okay, you are good. Definitely, I'm going to tell everyone's going to make mistakes. Ain't no one perfect. Okay, but what you should do is you should forget about happened before so that your next case is not affected. I hope I helped you, with your doubt.
Okay, I have another question about anatomy. Is it enough,
Yes,
the
please.
illustration which is present in our notes? Is it enough for us, or is there anything extra?
Yes, this question is a very frequently asked question. Throughout the generations, many people have asked these questions. So you have to remember one thing: this is a very standard exam, right? If imagine if everything in your exam, right, was leaked before, would this be a good exam? Would this exam be able to assess which people those people who understand, those people who deserve to pass? Would it be able to determine who knows and who don't know? No, right? That means the pictures that are in the notes, they are standard pictures. They are relevant pictures for exam in the sense that this region or this anatomy is questioned, or this anatomy is something that you should know for your exam. But the actual exam will be definitely be different. It will be different, right? The goal of the notes is not to leak the exam papers. That is not ethic. That is not even something that's ethical. But the goal is that so that orient you well, that okay, your neck anatomy is very important, gland anatomy is very important, heart anatomy is very important, abdominal anatomy is very important. So you have a standard picture for this. You can understand the orientation of the different organs, and so that even if they give you a different picture, you're able to confidently identify as well as locate and answer the following questions. I hope I've cleared it out.
Yes, thank you.
So anyone else has any other questions, please? Okay, no one has any other questions. Any queries, please? If you're new, you don't know what to do for your upcoming exams, you can ask any questions, no problem. Go ahead.
Also, I want to say one thing is like, don't let your fear of, okay, what's going to happen, what other people are going to think, ever hinder
Exactly.
you from, clearing your doubts and all that. That is going to be a very grave mistake that you will not recover from. Okay. This exam is going to put you out of your comfort zone. Okay. And it's going to test you in that way. So feel free to ask. And, this is going to help you. Okay. Because when you're in the exam, some examiners, professors, everyone with white hair, right? You're going to think, oh, you'll be so, what is it called, scared, like, oh my god, these people are judging me, am I even suitable to sit here? You'll question, am I worth it, did I do a right thing of even appearing for this exam? You'll have such a strong fight or flight reflex. You'll feel like, you know what, I don't care, I'll just leave everything right now and I fly back to my country. I really got that feeling, right? So don't let your fear or embarrassment stop you from clearing your doubts. Yes, I think someone has a question in the chat. Time duration for study, 3 months with full-time job enough? I have heard some legendary people do that, 3 months with full-time job. Definitely it is possible, but it all depends upon what is your basic understanding, what is your residual knowledge, and how effectively you learn. So if you take a long time for learning something simple, probably this is not the wise strategy. But if you already know everything quite well, and your skills are very good, then yes, you can definitely go for it.
Okay.
My personal preparation time was 1 year. I took 1 year for preparing. So yeah, alhamdulillah.
Hello, I have a question.
Yes, go ahead.
Okay, congratulations, Dr. Esra. Okay, so
Thank you
my
so much.
question, welcome. My question is that how the passing rate is determined, like how they determine who will pass or not?
Okay, so this is actually, I'll tell you, it is definitely, it's a very valid and a good question. This is something that really perplexes a lot of candidates. It also perplexed me, like okay, like I've seen some stellar people fail, and I've seen some people who could not give that much time to the studies, still like just 3 months with full-time jobs, still they passed, right? So that really confused me, like, okay, wow, how is it determined, right? So if I think it's already shared in the group, and I'm probably in just these few minutes, right? I've repeated this a lot of times. The breakdown of the marks, that this is what determines who will pass and who will not, right? Everything, it's like, for example, at least in our country, there is a lot of all or none law during passing. So if you make a one mistake, no matter how perfect you do everything else, you are going to fail. This is what we call gross mistake, right? I think you're familiar with that. So nothing like this exists in that exam. Nothing like this exists in that exam. Everything is very itemized. Everything is very broken down into its individual parts, right? Just for greeting the patient, you have a mark. Just for thanking the patient after the examination, you have 1 mark, right? So there is a detailed breakdown, and you'll see a lot of the candidates, they refer to this, and they I strongly suggest everyone to go through that before you go for your marks. And finally, once everyone's exam is over, the pass rate is actually, it is not a pass mark, or not even a pass percentage. It is a pass percentile, in the sense that on that particular day, right, of all the candidates who have attended the exam, right, they see what is the score of individual, right? Because you can see some days the questions or the stations are quite difficult. Other days the questions and the stations are quite easy. So you cannot compare day one with day two, right? That's why what happens is, just only that particular day, all the candidates are judged one against each other, right? Because they all of them have the same examiners, all of them have the same stations, all of them have the same pictures and the models and everything. So you can understand that this is a very fair way of what is it called, marking people. And the thing is, based off, so they look at everyone's mark, they see that, okay, if everyone is quite good, then in that case, the pass mark becomes high. Or if this is everyone is, faring poorly, in that case, the pass mark is slightly low, right? It's a bit difficult mathematics, but I remember I did not bother much with it. Although it was a very perplexing question, I did not bother much with it. I focused on only those things that are in my hand: my preparation, my dedication, my confidence, my cool composure. These are the things that I focused. So my advice to you is that you have a very valid question. Okay, in no way is this a wrong question to ask. But my thing is, this is the way of life, right? Some things are in your control, some things are not. Just focus the ones that are in your control and make yourself better. Make yourself such a candidate that they are all, badho. They are all, they're forced to give you that mark. I hope I'm
Dr.
able to,
Khairul,
convey it to
Dr.
you.
Khairul,
Yeah.
I want to say
Thank
one
you,
thing
Abba.
to
Thank you.
you.
Yeah,
Dr.
sure,
Khairul,
bro.
don't
Yeah,
think
bro.
about the cutoff marks, okay? Make the cutoff marks. You mean,
Yeah.
are you getting what I
Very
want to
good,
say,
very
right?
good saying, Dr. Atiz.
Yeah.
Hi, you should put it in a plaque someday. Don't think about the cutoff marks. You may ensure that people
Yeah,
are worried about you when you're entering the exam. That's just a
exactly
joke,
right.
but I'm just saying it lightheartedly. But yeah,
Yes, it should be.
exactly.
It should be. What exactly Dr. T, what exactly Dr. Arvind, what exactly Dr. Esra, all of them did the same thing, right? So they made the
Mm-hmm.
cutoff mark. They weren't thinking about the cutoff mark. Okay, all of them are the
Yeah.
topper from their own days, right? So don't think about this. Okay, you will be good.
Okay.
Don't worry.
Inshallah.
Don't worry. Yes. Okay, Dr. Nargis, you have a query, I guess. You raised your hand. Dr. Gupta, you want to ask anything?
Yes, sir. Good evening, sir. And thank
Another
you, ma'am,
topper is
for your
talking. Yes, go ahead,
Yes,
Dr.
a
Gupta.
topper in the making, a topper in the
Yes.
job. Very good. Nice to meet you, Dr. Gupta.
Yeah, congratulations, ma'am.
Thank you.
Just few days back, I just got a question from our colleague. They were searching for the recalls. So is it necessary to go for new recalls of 1 year or 2 year? Because Dr. Atik sir has already told you don't have to look for, because he is doing all the recalls, collecting and giving in the PDF and the lecture. So should we go for that? Because it's
Yes.
very difficult to collect and it is time consuming.
Yes, very good. This is a very good question. This is something, it's good. Like all of you who are attending this session, right? These are the questions that plagues everyone before their exam. Should I focus on revising, or should I, start, knocking people about what they ask? No. At least I can say this confidently. Okay. Dr. Atik has, collected all the recent questions of
Yeah.
at least the past couple, this year at least. The entire, so you're updated, all your materials are updated, you don't have to worry about it. And also I'll tell you this one thing, okay? All the stations were common, at least in my exam. All the stations were the paid station, the known station, the common station, the frequently asked station. Only probably a few questions were extra in each of the station, but I can tell you this, that these questions did not determine pass fail. The questions that were asked before, right, the common questions, that determine pass fail. And remember, you're going with this intention that I want to pass the exam no matter what. So think, for passing the exam, you just have to revise your notes that is already with you in your hands. Okay, but for acing the exam, for getting that one or two, unicorn type of question extra, you have to knock a lot of people, waste a lot of time. So what is more efficient, what is more effective? Just go, like I said, stick to one notes and just read them properly, so that when you go to the exam, you perform extremely well, right? So Dr. Gupta, don't worry about it. Your preparation
I
is going
replied
good,
the
I
same
already know that.
that I replied the same that this is sir's job and he is doing wonderful to us. So if anything extra he want to add, though he will add. We have to study the material.
Yeah. And see, like I told you, right, this is a standardized exam. Once you pass this exam, you deserve to be proud of yourself, right? You deserve, to pat yourself on the back, because this is a very standardized exam. Definitely, there's going to be some questions different, right? To just pick out those who know from those who don't, right? So nothing to worry, but that is nothing to worry about. That will come to you. That God will give you as a gift. But your hard work you should put in.
Definitely. And so during revision, so we have to go through PDF. I have asked sir also the same question. So during the revision, because my exam is in January, so I have to revise it with the PDF or just with the video, the class video, lecture video.
Yes, yes, yes. What I did is I listened to the videos with the PDF in front of me, because like the books, right? What I did, I had my own annotations and all that, and I'm pretty sure you also have that, right? You have your own annotations, or okay, because in the books only is where you mark up. Okay, I'm weak in this question, right? So it's good to have that in front of you, but just for the purpose, like say for example, if I just tell you learn 10 stations today, you will take the entire day to learn 10 stations. But if I told you, okay, just listen to 10 stations today. So 10 stations, I think the recording is not more than 3 hours, right? So you can understand that, because just before exam, time constraints and time management is very important, right? You have to be able to finish the entire syllabus in a couple of days, so that during the exam they come to you instantaneously. You can answer just out of the tip of your tongue, right? That's why just for why the recordings are very good is because just in a very time specified manner you can complete the syllabus. That's why that's a highly recommended way to go through that. Also, you can listen to it while you're traveling and all that, because it's not easy to have your books all the time with you, right? So when you're listening to and from your book, that will really help build your basic knowledge or background knowledge.
And for knowledge part also, do we need to practice with the partner, or we have to do the self-study? Because I'm more into the self-study, and it gives me me insight, and I'm able to plan my study also.
Yes, that is a good question. That's a good question. But the thing is, see, you're not tested on how much you know. This is something wrong. Okay, this is a wrong conception. A lot of people think, okay, knowledge part is testing how much I know. Not at all. Knowledge part is testing how much you can produce out of your mouth, right? So this is a huge mistake. Everyone can learns it well. But I don't know whether Dr. Gupta, have you noticed that? When you're answering in mock, right, you feel like you already know this. You learned it an innumerable amount of times, but for some reason, your tongue is feeling the difficulty of producing that. Have you felt that?
Yes, definitely. That's why
Dr. Gupta, remember what I have said to you?
Yeah. That's why I'm asking also.
Yes, that's why it is a very wise thing to have a good and loyal study partner who's going to be there right beside you through thick and thin. Okay, because if you don't produce it well, no matter how much I know a lot of very knowledgeable people who've had difficulty passing the exam, or have had to come appear for the exam a couple of times before they passed, right? This is not an exam of how much you know. This is an examination of how much you can produce. So remember that. So Dr. Gupta, I'll say you are very good, mashallah, but you better to attend mocks as well as have a good study partner, so that you can always keep on saying it and keep on producing those answers in a timed manner.
So I have only 2 months now. So is it okay that I can do it? Because yes, I know the matter.
100% I can say you can do it. I will say that yes, you can do it, because I have taken your mock once, so I know.
Okay, thank you. Thank you very
So
much.
best of luck to you. I'm
Thank
looking
you.
forward to your success.
Thank you, ma'am. Thank you very much.
I'm looking for Dr. Gupta's success story.
Yes, I will attend that. I will definitely attend
Yeah.
that. I remember I attended Jaman Show guys and Dr.
Yeah.
T's. I don't know whether Dr. T was able to attend, but I was listening just before my results came out, and I still felt like I still have so much to learn from their experiences.
Yeah.
Dr. T is with us. Isn't Dr. T going to share her experience? I don't remember
She
her
already
sharing the
shared.
last time. I'm looking
She
forward to
already
it.
shared, yeah.
She did? Oh, okay.
Yeah, she did.
I
Yeah.
probably have missed that.
But she can add,
That's
no
wonderful.
problem, if she wants. All right. So anyone wants to ask anything? Dr. Nargis, you raised your hand. So you want to ask anything?
Yep. I
Yes, go ahead.
wanted to, before I couldn't unmute my mic.
Go ahead.
Assalamualaikum, Esra. Hello.
Walaikum assalam.
Yeah, I had one question. I mean, it's my own weakness. I mean, I'm very bad at communication, so this is a very intimidating examination for me. I had a question. I mean, it's like if any of the stations, it's not something that you know, or sometimes when we are nervous, we go all blank, right? So how do you propose to handle those stations? Where like sometimes it happens to me that okay, I knew the answer and everything, but then after the question is over, or after the time went, or after the time passed, I remember what I was supposed to say, and in that time I'm all blank and I can't say anything. How do you
Yes.
advise to handle those kind of situations?
Okay, this is an excellent question and it's quite relevant to all of the candidates. You know, going blank is something that it's ubiquitous, right? It's something that we've all experienced, you know, in some way, shape, or form of or the other, right? I will tell you my experience from my exam. Like I'm here just, you know, sharing all my weaknesses. Okay. Why? Because I want to be very frank that even if you mess up, you still have the chance of passing the exam. In the neck anatomy, okay, they showed me a particular vessel. Okay. I said that it's common carotid artery because I was not able to identify. What I did is I just blurted out something. This is something wrong. When you go blank, it is your brain's protective mechanism and you should trust yourself. Later on, the entire station is over. I'm sitting there looking at the picture because I know I messed up something. Okay. Then it just came to me. It was actually vertebral artery. It was not common carotid artery. Dr. Nargis, do you understand that?
Yeah,
What
yeah.
happened? What went on? So when you go blank, okay, particularly knowledge station, I say it time again and I keep on repeating this. When you go blank, your job is if the answer doesn't immediately come to you and you're not confident of the answer, right? Don't just blurt out something just to fill the gap. What you're supposed to say is, may I please come back to this later? You're supposed to say that. Do you understand? Make this your reflex. When something doesn't come to you in knowledge part, you have to say, don't just sit there and wonder or try to recall, okay, what was it? What was it? Was it? No, no, no. What you're supposed to say is, I'm so sorry, sir. May I please come back to this later? And then they will move on to the next question. Okay. Finally, by the time all the questions are over, inshallah, it will come to your mind what it's supposed to be. Or then you will remember and then you can correct yourself. Yes, and the examiners are very good about it and they're very lenient. So if you say something that, you know, may come back to this, they will respect the fact that you're mature and you know your weaknesses, and then you've managed your time well. Because a lot of candidates do what? Two things. Number one, they sit there and they just sit quiet and they try to figure it out. Okay, what is this? What is this? This is a huge mistake because you will not be able to cover the rest of the questions. So that's why this is a huge mistake. And number two, the thing is, imagine you said something wrong, right? Right, you will not be able to recover that question at all. And later, when eventually, right, and inevitably, the right answer comes to you, you will regret for the rest, and this will be the cause of your, insomnia and nightmares. That happened to me.
Yeah,
I was
this
like,
is
why
what I'm
is it?
afraid of because of the time constraints, since the time is very limited. You don't have enough time to think about it and then come up with the answer.
Just respectfully say, sir, may I please come back to this later? And once the question answer, try to figure, then you have lots of time just to think about that answer, right? So you just calm yourself down and think about it. And very, very important about learning and revising multiple times is that, everyone, right, all our genetic makeup is different. You will see that for particularly you, just targeted to you and customized to you, there are some portions of anatomy or some portions of critical care or pathology that for some reason, inexplicably, you have doubts, you don't understand, or always you make mistakes in that portion. So this is the reason why you should, attend mocks or at least study repeatedly with the same study partner, is that you'll be able to exactly identify where my weaknesses are. And then what you should do is, I colored my book and all my weaknesses with a single, the yellow highlighter. So whenever I'm, revising or opening my books, when I see the yellow highlighter, it always strikes to me, yes, this is my weakness. And then I try to close my eyes, calm myself down, and say the answer properly in my mind. And then when I check it up, yes, the answer is correct. So this is one thing that you can prepare beforehand. Definitely you have some mistakes, right? Always repeatedly you will be keep making, like it was the same for me in part A also. For some reason there were some MCQs, no matter how much I learned and became the PhD of that, the topic behind the MCQ, I still kept on making mistakes in that MCQ. So this is just about revision and practice, revision and practice. Another thing I want to say, one very short thing, is that particularly in critical care, when the management portion comes, right? I forgot to say it before. You have to be very professional when you answer this. And you have to, like, for example, if it is an ATLS or some trauma, you have to say, I will manage this patient as per advanced trauma life support, right? Protocol. And then you will go ahead. And the other one, you will say, I will manage this patient as per care for critically ill surgical patient protocol. I know some candidates who they examine in a couple of days and still, right, they say crisp, crisp, crisp. This is highly unprofessional. You will see that you're irritating your examiners a lot. So keep these simple things, but keep it in your mind, right? This will help you where? This will help you in your global score, right? Global score, your impression. I hope I helped you, Dr. Nargis, right?
Yeah,
This
thank
is
you
how
so
you're
much.
supposed to tackle. You're welcome.
All right. Anyone else wants to ask?
Yeah, I have another question. Like, how a candidate should use the last hours of time? How they prepared, like last 7 days or 4 days, 5 days? How they should go through the materials or the other things?
For sure. So by now, right? You're picturing yourself is just a week before your exam. So by now, ideally, you have to have learned each of the topics at least 5 to 6 times, right? And in this 5 to 6 times, every time you had went through the topic, you're annotating your notes and identifying your weaknesses. Like, okay, this is difficult for me. For example, for everyone, what is the challenge? Learning the doses, right? So at least your doses should have been colored in a different color. So by now, what happens? Your entire note is color coded in the sense that there are some things that are like triple star or something, right? So just the 7 days before your exam, you will just brush through all of the topics, but you will give emphasis to which one? The ones that are quite important, like the mark carrying ones. Say, for example, in critical care, all the management portion is very heavy mark carrying, right? Or in pathology, pathology is actually, the definition, like all the definitions. These have a particular amount of mark, right? Or explanation. These have some fixed amount of mark. So yeah, the important in that particular station, by now you have already marked all the important things in that station, 2 or 3 things. Now you already know, say for example, you already know the definition of alloplasia, you already know the definition of metastasis and all that. This is not something that you should focus on in the last 7 days. The last 7 days you have to focus on those things that are difficult to remember or a very high yield. Okay, so what you're supposed to do is, right now while you're studying, right, don't just keep your notebook blank, right? Or your text or your notes blank. Have a marker in your hand and try to mark up, okay, this is important, this I should say like this, right? Like this. I hope I am able to explain to you, right? Just brush through everything, but the high yield points, or at least the one that are difficult for you to understand, learn them well and repeatedly in that time. Also another thing, if your exam is not on the first day, your duty is always to stay up to date with the the stations that came in the previous days, as well as the questions that were asked in those previous days. So that's what you're supposed to do is that, at least I knew 6 months ahead that my exam is in Kuala Lumpur in September, right? I used to always keep a very good contact with at least one candidate or 2 candidates on each of the days. So just before my exam, I had someone who was very dedicated and honest, who told me all the questions, as well as who told me what the examiners want, or what the station was, or what the diagnosis of that particular station was. For example, I had a spine examination, right? And the diagnosis was not PLID. The diagnosis was lumbar canal stenosis. So I knew this. Why? Because I had a friend who gave an exam the day before me, and she told me that this is lumbar canal stenosis. So I made that diagnosis during my exam, even though I did not get any, that relevant findings. Okay. So this is also something that networking is very important. It is not only important for your exam, it's important for your entire career. You have, because humans are not like one-man army, right? You're not supposed to be in one-man army. You're supposed to work together, right? So this networking issue is very important. Make friends so that if you're not on the first day, you have someone who gives you those questions. And because what happens, literally the same case gets repeated on the next day. I remember I gave my exam on the 13th. My friend who gave her exam on 12th, I had 5 or 6 stations common, literally just common, copy paste, right? The entire, so those were a blessing that really gave me the extra boost of confidence. Like you cannot, you can't have any lack of confidence. You're going to grab everything, okay, just to improve yourself, make yourself better. I hope I'm able to answer your question adequately and satisfactorily.
Yeah, thank you so much.
You're welcome.
All right. So anyone else wants to ask anything, Dr. Esra? Okay. So thank you, Dr. Esra. Don't go anywhere, okay, because you have some work to do. All right. So
Thank you,
thank you.
Bhai.
And
I just want to
also,
thank you for this opportunity. I enjoyed, communicating, and I enjoy, sharing and, getting feedback. And I wish the best of luck to all the candidates. Believe in yourself, work hard, and inshallah, good days are coming.
yes, thank you, Esra. Again, congratulations for your very nice result, okay, and your bright future. So lastly, I want to say is whenever I met Esra in last year, when I was taking the mocks, uh, after this 1 day or 2 days, I said, you are a brilliant student. Okay, so if you want to participate in something other than the just only for the participation of the mocks, right? So I said like you are going to pass this, don't worry. Okay, if you can remember Dr. Esra about that. So
Yes, I
yes,
can. Bye.
yes, here it is. Okay, Alhamdulillah for everything. Okay, very nicely done.